Welcome! This video will illustrate the process for a fruitful cooperation between DTM and partners, aiming at obtaining useful and usable data for humanitarian response. We also have some good tips. You can pause this recording at any time if you would like more time to review a concept. The main reason why we use an agreed process in DTM and partners cooperation is for DTM to collect data that partners need for their analysis and response. Even when DTM asks partners, give us 3 questions for your sector that we can include in our data collection, we often see that the collected data are not what partners need. We have worked together on a different approach to get the data that partners can use. We realize that DTM is not the only data provider facing this type of challenge. So we work together with many sectors, clusters, experts and organizations under the Grand Bargain workstream for needs assessments. We found that these were very common challenges, and we also jointly identified some solutions. DTM and partners implemented these solutions and created a cooperation approach as well as tools to help DTM and partners in the field better cooperate. This is now available online on the DTM and Partners Toolkit. All this talk about partners deserves a definition of who a partner is for DTM. Any organization, agency, institution or group that can use DTM data for humanitarian response is a partner. One of the many outcomes of the joint work under the Grand Bargain is a commonly agreed process and roles and responsibilities for both DTM and partners. Let us now look at the first steps of this process implemented by DTM when a crisis first starts or a disaster strikes. In such situations, time for engagement is limited, so DTM starts a first round of data collection by engaging with other data providers and identifying main information gaps, then identifying the appropriate DTM components or methodologies for the response, and assessing and minimizing risks that come from implementing data collection. Once that is done, DTM teams design data collection tools using the DTM Field Companion, train enumerators, and start data collection. The DTM Field Companion is a list of sectoral information commonly needed by partners in emergency response that can be collected through specific methods of data collection, for example, key informant interviews. They were designed by global sector and thematic experts and formatted as data analysis plans to help the colleagues in the field. The Field Companions by sectors and theme are downloadable from the DTM and Partners Toolkit website, open to all. While the first round of data collection is on its way, DTM works on identifying the partners in the context and plans engagement. In the meantime, partners will have had to identify the decisions they have to make for the response and the information they need in order to make such decisions. Partners also review available data and identify the remaining information needs, called information gaps, that existing data could not provide. This will have to be collected by DTM or other actors. But what is an information need? Well, it is not the question we have in the questionnaires. It is the information I need in order to make a specific decision about my response. A question is one possible way to obtain that information using a specific method and source of data collection. One of the foundations of the cooperation between DTM and partners is that we start from decisions, not from questions. We walk backwards. First, identify the decision, then identify the information needs and gaps, then identify the appropriate method and source for each information. Only at that point we develop questions, and data collection tools. This ensures that there is always a link between the questions, the data, and the final use. Partners at this point have to understand the DTM methodology used in that specific country in order to know if DTM can collect the information they are missing. This is because each method and source provides some information but no others. There is no one tool to collect everything, and different information will have to come from different methods and sources. For example, if in a country DTM is implementing only the MSLA through key informants, the multi-sector location assessment, and the information needed by partners can be collected through key informants, through closed interviews with non-sectoral specialists, then the DTM MSLA can collect it. If the information can only be collected through focus group discussions, for example, with homogeneous groups, then MSLA will not be the right tool to collect it, and partners will have to collect that information themselves or ask others. One tip for effective cooperation between DTM and partners is, in fact, DTM should explain in details the methodology they use, and partners should understand it. As a minimum, it should be very clear to partners where the exercise collects information, what locations, regions, how often, who is the source, who is DTM asking, what is the method, is it done through closed questions, open-ended questions, who are the enumerators, are they healthcare workers, protection experts, generalists, and what the exercise can and cannot collect. Once partners and DTM have identified the needed information that can be collected by DTM, then DTM and partners jointly revise the data collection tools to include questions that provide the information gaps. As information needs and use have already been clarified, DTM and partners can use the DTM Field Companion to search for questions that provide the needed information. As mentioned before, the Field Companion is a list of sectoral information commonly needed for emergency response that were identified by global clusters and other global experts and deemed appropriate for specific methods like the key informant interviews used in the DTM multi-sectoral location assessment and village assessment. These information needs are also included in the DTM data dictionary. Each information need is directly linked to suggested questions and reply options in English, suggested use of its results, suggested descriptive analysis and visualization, how the information should be shared, whether publicly or not, and preconditions that must be in place to include questions in questionnaires. The Field Companion by sectors are available in Excel and PDF form. In the PDF version, you will find one information need in each page, while in the Excel version, you will have one information need in each row. The information is identical in both versions. How does the Field Companion help you? After the information gaps are identified, the DTM Field Companion can suggest possible question phrasing for key informant interviews, for example. The questions should, of course, be adjusted to the context, as well as the option for reply. It is important that colleagues do not use the Field Companion as a list of questions to choose from without having first identified their information need and their use. Remember always to create mock-ups. These are simulations of end results, of questions that you include in the questionnaire. Partners should check the mock-ups before data collection starts to see if the results are indeed the information they need. Mockups save time and money and help get useful information. Mockups are part of a data analysis plan that should be developed before the questionnaires are finalized. Those plans should be shared and commonly held by DTM and partners to ensure expectations are transparent. Imagine you're building a house. Would you ever start without a written and visual plan? The DTM Field Companions, remember, are formatted as data analysis plans to help colleagues in the field save time. A very important step before finalizing the data collection tools is to ensure that the questions, the results, and the analysis is not likely to create harm. As questions, data, and their analysis may put people at risk, DTM and partners must assess if questions may create additional risk for enumerators, for key informants or any interviewed person, for communities, and for the organization themselves. If they do, the questions must be changed and reassessed. Context or cultural experts are crucial for such an assessment. A practical tool for this risk assessment is the DTM Do No Harm checklist, also available on the DTM and Partners Toolkit. It helps assessing the risk during data collection, data storage, data analysis, and data sharing. Before finalizing the questions, it is important that DTM and partners agree on data sharing modalities, identifying what data can be shared publicly and what data is confidential and must be shared appropriately to ensure that information does not fall in the wrong hands. Some data may be needed right away by partners and are defined as data for urgent action. The next step is the DTM enumerators training. This is DTM responsibility. However, some partners can support the training with their specialized expertise. For example, protection, child protection, GBV, prevention of sexual exploitation and abuse, mine action, etc. DTM then collects and shares the data for urgent action with partners. Partners use the data for urgent action to immediately respond to people's needs. Once all data is processed, DTM shares remaining data and some descriptive analysis. One thing that is crucial to enhance cooperation and partners' ability to use the data is knowing where to find DTM data. Often, this is not clear, and DTM should always show to partners where to find their data and communicate when the data will be shared. Where can partners find DTM data? Depending on the country, data can be shared through mailing lists or through the Humanitarian Data Exchange site. For confidential data, the country office of the partner will have to sign a data access request form. The forms in 3 languages are available on the DTM and Partners Toolkit. All data sets that are not confidential will be uploaded on the DTM website, as you see in this slide. Once you are on the DTM website, you can click on Countries on the top menu and choose the region and the country. Then scroll down to the bottom of the page and click on Datasets to access datasets for that country, or click on Reports to access reports from that country. You can also click on Maps to visualize relevant maps. It is also very important that partners know what DTM data look like and how to read them. For example, in the downloadable Excel files, each row contains information about one location, for example, a village or a camp or a site, and each column contains one type of information about all locations. Often, there are additional tabs in the Excel file that explain the data. Partners should also know the level of details that DTM data reach. Usually, DTM MSLA data are available at location level. This means that data can be aggregated and analyzed from locations to district, province, governorate, or country level, as in DTM reports. Finally, one can use DTM data at location level to compare between locations or to design interventions for each location. At this point, partners will have to analyze the DTM data. Partners will use a variety of data for their analysis and response. DTM data as well as other data from other sources, including sectoral assessments, situation monitoring, qualitative focus group discussions, and secondary data. Partners should analyze all the useful data from all sources and methods to be able to respond based on evidence, as no source or method alone can provide the whole picture. Let us see here whose role is it to analyze. Well, the role depends on the level of analysis. We often speak about analysis, but we often mean different things. For an information management officer, analysis is mostly charts, maps, tables. For a protection officer, it would be a narrative explaining the reasons, the risks, the impact, and so on. Indeed, analysis is many things. It is useful to think of analysis in humanitarian context as composed of different levels. Each level of analysis builds on the previous one, answers specific questions, and is performed by people with specific skill sets. For example, the first level, describe, is often done by the information management officers. In our case, then, DTM describes most of the data and shares data and descriptive analysis with partners, who are the sectoral experts, as DTM are not protection, WASH, education, or shelter experts. Partners are sectoral or thematic experts and therefore will further analyze to explain correlations and interpret what information means. They will then try to identify an appropriate response. Remember to agree in advance on which levels of analysis will be analyzed by DTM and which by the partner. If nobody can analyze the data, do not collect them. At this point, partners will design and implement response and give feedback to DTM based on the actual usability and usefulness of DTM data. DTM then uses feedback to improve their data collection and will reassess risks before the next round. The last important tip for fruitful cooperation is to learn to deal with lack of trust that some partners may have towards DTM data. Remember that no data set is perfect and that having different data is an opportunity to learn more about the situation, not to compete. Two sets of data will never be identical. Many factors may account for different data. For example, the time of data collection, as things change rapidly. The phrasing of the question will influence the answers. New events, they can change their answer because now there is a new delivery of food or because water network has broken. Administrative boundaries may be different. Location names may be confused. Admin units may not coincide. Healthcare units often do not coincide with districts. Methods of data collection may be different. Sources may be giving different answers. Men versus women may be given different answers. Coverage of the data collection exercise may be different due to access restrictions, for example, that were not in place a month ago. How to solve this? Well, there are some practical approaches to different data, including 2 different population data. Some suggestions are available on the DTM and Partners toolkit. We have now reached the end of this video on the process for cooperation between DTM and partners. Remember, following the process will help obtaining DTM data that are useful for partners. A step-by-step description of the process and many useful tools for field colleagues are online on the DTM and Partners toolkit. Check out also the pocket guide on the approach, process and roles, and an illustration of cooperation in comics. They are both available in English, French, and Spanish on the DTM and Partners toolkit, together with many more useful tools. And don't forget to explore the DTM and Partners toolkit to find the help you need.